Hello, I'm Dr. Ayub, a consultant psychiatrist. Today we are here to discuss a very important psychiatric illness, that is childhood autism. This is a pervasive developmental disorder and also known as autism spectrum disorder. The autism spectrum disorder, what are the presenting problems? These child present difficulty in language or communication, which never develop or sometimes develop normally and disappear thereafter. Difficulty and social skill or impaired interpersonal relationship. The third area is restricted and repetitive behavior. These are the three key areas these child have difficulties. If we see these symptoms or problem in more detail, these all symptoms start before the age of 3. The language or communication difficulty involves both verbal and non-verbal communication difficulty. And delay in speech is one of the most common reasons for referral to psychiatrist, pediatrician, or any other doctor. This is the most common concerns by parents. The other area is impaired social skill. These child have difficulty making relationship with their parents, difficulty making relationship with their peers, difficulty to share enjoyment, difficulty to play with other child. They have poor eye contact. The third area which is impaired in this child is restricted, repetitive, stereotype behaviors and interest. This child has very narrowed interest. They liked particular type of food and they are resistant to change. They are more stick with routine, timetable and particular aspect of an objects. Sometimes these child present with abnormal body movement like body rocking and hand flapping. Language or communication difficulty, social skill impairment, restricted and repetitive behavior. These are the three areas in which this child has impairment, and these should all start before the age of 3 here. These children may present with some other problems like learning disability, which is very common in autism spectrum disorder, seizure disorder, ADHD, depression, anxiety, OCD, and tic disorder. There are some other variant of autism spectrum disorder or ASD. One is called Asperger syndrome. Asperger syndrome is a milder form of autism that is with normal IQ and normal language skill. The Asperger syndrome usually starts in older children, that is after the age of 3. Another term that is called high functioning autism is Asperger syndrome with impaired language ability. These are some of the variants of autism or childhood autism. Let me see what could be the possible reason behind the impairment in certain areas of functioning. Like these child have normal hearing, normal vision, but instead of that, they have difficulty in relationship, difficulty in empathy. So what could be the possible reason behind this? One of the explanation is failure to develop the theory of mind. The normal child at the age of 3 or after 3 years of life, they develop what we call a theory of mind. That is knowing the perspective of other people, knowing that the other people has mental processes and appreciating that process is called a theory of mind. One of the reason that's why these child lack empathy. Another explanation for autism is failure of pruning. Pruning is a process that normally start after the first decade of life, in which the unnecessary synapses, unnecessary brain areas are eliminated. And these child, the pruning is failed to occur normally. If we see differential diagnosis of autism spectrum disorder or childhood autism, this include other pervasive developmental disorder like atypical autism, Rett syndrome, childhood disintegrative disorder, Asperger syndrome. This also include intellectual disability, a specific developmental disorder of language and speech, deafness, reactive attachment disorders, stereotype movement disorder. These are some of the differential diagnoses. This is more common in male, 4 times higher in males, and the risk to further child is 3 times higher. The management is start with a detailed history, a thorough examination, and some chemical or blood investigation. In some cases, genetic testing, CT, MRI, EEG, hearing test. Psychological investigation include ADOS, Autism Diagnostic Observation Schedule, DISCO, Diagnostic Interview for Social and Communication Disorder, CARS, that is Childhood Autism Rating Scale, IQ Scale, and Inverse Developmental Rating Scales. Treatment is multidisciplinary, that is by a psychiatrist, psychologist, occupational therapist, pediatrician. If we see the treatment, there's no specific drug to treat the childhood autism, but there are some evidence to treat particular symptoms in these child. For example, for self-injurious behavior, low-dose antipsychotic is indicated. For restricted and repetitive behavior, there is some evidence of SSRIs. For social and communication impairment, memantine and oxytocin show some benefit, while for sleep disturbance, melatonin is indicated. The mainstay of treatment in childhood autism is psychosocial treatment that involves education, reassurance, self-help, supportive counseling, and family support. The specific treatment, which is particularly done before starting the school or at the school to improve communication, attention, and social skill, is called early intensive behavioral intervention. This involves sensory integration, auditory intervention, visual therapy, and music therapy. Some studies show that dietary uh, habits like gluten and casein-free diet has some role in improving the symptoms of ASD, but this is not proven by many studies. With this, thank you for listening.